Welcome to my YouTube channel. Today's physiology is tomorrow's medicine. Once again, we are going to crack a neat page MCQ in this session. The question is, two patients undergo an orthostatic standing test. In patient A, the blood pressure falls from 120 bar 80 millimeters of mercury to 95 bar 65 millimeters of mercury, and the heart rate increases from 70 per minute to 100 per minute. In patient B, the blood pressure falls from 120 bar 80 millimeters of mercury to 95 bar 65 millimeters of mercury, and heart rate increases from 70 per minute to 72 per minute. So the question is, which of the following best explains the difference in heart rate response? The options are, the option A is patient A has impaired baroreceptor function. Option B is patient B has impaired baroreceptor mediated sympathetic activation. And option C is patient A has increased baroreceptor mediated parasympathetic activity. And option D is patient B who has increased venous rhythm on standing. So overall this question may appear so confusing, but we will go one by one, and at the end it will be easy for you to identify the correct answer. In this slide we are going to see what is the orthostatic test. For this, the patient or subject has to lie down for 10 to 15 minutes, and we need to record the blood pressure and pulse rate. In the lying down position, the systolic BP is 130 and diastolic BP is 90, and the pulse rate is 72. The next step is, within 1 minute of immediate standing, we need to record again the blood pressure. If we see, the systolic BP is 110 and diastolic is 80 and the heart rate is 85. So from this we are knowing that within 1 minute of immediate standing, the blood pressure falls and the heart rate increases. In the same subject, after 3 minutes, if you record the BP, it is 128 systolic and 86 is diastolic, and the pulse rate is 75. So it is clear from this, after 3 minutes, the BP returns to the normal value. So we are going to see how is it happening, what is responsible for this changes, and if there is a decrease in blood pressure more than 20 millimeters of mercury, even after 3 minutes, we call the condition as orthostatic hypotension. And what is orthostatic hypotension, and what is the reason for that, and how is all happening, we are going to see in the next slides. So a small refreshing our basic physiology ideas, that is baroreceptors. As the name implies, baro means pressure or stretch. So this are receptors. So baroreceptors are receptors which sense the pressure or stretch in the blood vessel, and they send to the center, and according to the pressure in the blood vessel, there will be vasoconstriction or vasodilatation. So the baroreceptors are responsible for the changes in the blood pressure and heart rate. So we are seeing here the location of baroreceptors. The baroreceptors are seen in aortic arch and carotid sinus. So these are the baroreceptors which is going to sense the pressure in the blood vessel and going to take part in the baroreceptor reflex. So here there is a short video showing the increase in blood pressure causes stretch in the blood vessels, which is sensed by the carotid sinus baroreceptors and aortic arch baroreceptors, which is sending afferent to the center. And this is one more video which is showing that receiving efferent from the baroreceptor, and based on the input it will send efferent to the heart as well as to the blood vessels to control the BP and heart rate. So based on this we will move to the next slide. So in this slide, we are going to see in detail about baroreceptor reflex. We already know that the baroreceptors are situated in aortic arch and carotid sinus. Both these will send the impulse to the center nucleus tractus solitarius depending upon the stage in the blood vessel. The parasympathetic afferent is taken by the nerve called glossopharyngeal nerve, and from the nucleus tractus solitarius, the afferents represent afferents to cardioinhibitory center, which is present in the medulla, and from the cardioinhibitory center, the efferent through the vagus nerve, it reaches the heart. So the vagus nerve in the heart will decrease the heart rate and decreases the contractility. So this is the parasympathetic function of the baroreceptor reflex. Likewise, there is one more center called as vasomotor center, which is present near the cardiac inhibitory area. This will send impulses to the sympathetic ganglia. From the sympathetic ganglia, it also sends an impulse to the sympathetic nervous system to the heart. So here the sympathetic activity will increase the heart rate and contractility. And not only on the heart, the sympathetic system also acts on the blood vessels, which will cause vasoconstriction, and also in on long-term effect it also acts on the kidney to form renin-angiotensin aldosterone system, which regulates the blood pressure. So this is the parasympathetic part of the baroreceptor reflex, and this is the sympathetic part of the baroreceptor reflex. So it is very clear from this, the parasympathetic activity is decrease in the heart rate and contractility, and sympathetic activity is increase in heart rate and contractility. So the baroreceptor reflex has two domains, one is parasympathetic and sympathetic. Through parasympathetic, it decreases the heart rate, and through sympathetic, it increases the heart rate. This is a one more slide, again reinforcing the same information. The baroreceptors send the afferent to the nucleus tractus solitarius. So nucleus tractus solitarius, through the parasympathetic branch, it causes decrease in the heart rate by inhibiting the sinoatrial node, and the sympathetic will activate the cardiac accelerator center, so it increases the impulse in the sinoatrial node and contractility, and also vasoconstrictor activity is done by sympathetic nervous system through the arterioles and the veins. With this basic concepts, we now will go to the question proper. So what is happening to the BP when a patient or subject is standing from the lying down position, the blood pressure falls. So what is going to happen when the blood pressure falls? So when the blood pressure falls, it is detected by the baroreceptor as decreased stage, and it sends afferent signals to the centers, which are cardioinhibitory center, cardioaccelerator center, and vasomotor center. So there is a decreased BP, so it will decreases the parasympathetic output. So what will happen is when heart rate increases and contractile force increases, at the same time it increases the sympathetic output, so there will be increased vasoconstriction. Both brings the blood pressure returns towards regulated range. So it is very clear, whenever the BP falls, it has to be compensated by increase in heart rate and by increase in contractility and by vasoconstriction. This is a thing should happen whenever a patient stands from the lying down position. So with intact baroreceptor reflex, the heart rate and heart rate variability will be maintained normal. Now we will see what will happen when there is damage to the parasympathetic innervation. There will be decrease in heart rate variability, and also there will be excess intolerance, and fatal arrhythmia can occur. If the subject is having both sympathetic and parasympathetic innervation damaged, it will lead to orthostatic hypotension or silent MI or supine hypertension. So in which condition this neuropathy can occur is diabetic cardiac autonomic neuropathy. So there are so many causes. One of the causes is diabetic cardiac autonomic neuropathy. The parasympathetic and sympathetic innervation may get damaged. Sometimes it is also called as autonomic failure. So with all these facts in the mind, we will read again the question. The two patients undergo an orthostatic test. So these are the findings within the 1 minute after standing from the lying down position. Here, when we compare the patients, both the blood pressure falls significantly within 1 minute, and the heart rate increases significantly in patient A, but that it is not significant in patient B. This is the difference we are having now. With this, we'll go to the question proper. So, which of the following best explains the difference in heart rate response? Option A, patient A has impaired baroreceptor function. This is not true because in patient A, we have normal baroreceptor reflex response. Because of that, we are having a fall in BP is compensated by the increase in heart rate of from 70 to 100, which is around 20 beats per minute. So option A is ruled out. Coming to the option B, the patient B has impaired baroreceptor mediated sympathetic activation. So when we see the patient B, the blood pressure falls here. It has to be compensated by the heart rate, and it should increase from 72 to at least 80 or 90, but it is only 72. So this may explain the patient B has impaired baroreceptor mediated sympathetic activation may be true. So because of this impaired sympathetic activation, the heart rate didn't increase from 72 to 100. So answer may be option B. So now we will see rule out why option C is not correct. In option C, it is given that patient A has increased baroreceptor mediated parasympathetic activity. If it is true, then patient A should have not this heart rate, they should have very minimal heart rate. So option C is ruled out. And patient option D, final option is D. Here it is saying that patient B has increased venous return on standing. It is also not true. Even if though this increased on immediate standing, there will be decreased venous return. So it is not. This is also not true. So from this, the option the so the correct answer is patient B has impaired baroreceptor mediated sympathetic activation. So we will have an additional information on orthostatic hypotension. We already know what is orthostatic hypotension. Even after 3 minutes of standing, if the BP is not picking up, there is a more than 20 millimeters of mercury decrease in the BP. Even after 3 minutes, we call the condition as orthostatic hypotension. So what are the causes for orthostatic hypotension? One, it may be due to plasma volume depletion. The plasma volume depletion can occur organically by during fever or any during GI disorders like diarrhea or vomiting, or it may be iatrogenic also. Use of diuretic drugs can cause this. The other cause for orthostatic hypotension is impairment of baroreceptor reflex mediated vasoconstriction, and which is organic neuropathy linked to neurological disorders like diabetes, vitamin B deficiency, heavy metals, amyloidosis, and chemotherapy agents. In our question, it is because of the autonomic failure, which is caused by diabetes. And iatrogenic may be usage of sympathetic inhibition drugs can lead to orthostatic hypotension. All the best. Kindly subscribe my channel for further videos. We will meet soon with a NEET PG question. Thank you.